Good morning, everyone. We're here at our kitchen table for this kitchen table talk on pregnancy and childbirth and breastfeeding. My name is Judy Black. I'm the manager of the Children's Services Program, and a lot of responsibilities with our pregnant women and our new babies. And my colleague is
Amanda Mish.
And Amanda's responsibilities are
Working with pregnant moms and new babies.
So we're just going to do a little bit of table talking today, question and answers. And so Amanda's going to be asking me some questions initially, and I will give the answers and important information for you to have as a community member, especially if you are pregnant. And then we'll switch our roles, and we'll do something a little bit different as we go along here with the breastfeeding. So first question, Amanda.
Are pregnant women at higher risk for COVID-19?
There is definitely not a very solid answer to that because there's research happening at this point in time. But as you know, women's bodies are very different when they're pregnant, changes in their bodies and their immune system. So what we really want to encourage everyone to do is continue to protect themselves. So if you have any symptoms like a fever or a dry cough or some shortness of breath, then you need to let your health practitioner know that so that they can care for you appropriately.
Okay, so if I was pregnant, how can I protect myself against COVID-19?
Oh boy, that's a good question. And here in the community, we've talked lots about having respiratory respect, meaning like, you know, coughing into your elbow, covering your cough or your sneeze with a Kleenex, throwing it out, then remembering about your hand hygiene, always washing your hands with soap and water. If that's not available, then using hand sanitizer, and keeping your distance, just like we are today. And stay home. And don't be out in those crowds, and get someone to do your grocery shopping for you. So that's the way to protect yourself.
Okay, so what care should be available during pregnancy and childbirth?
The care that should be taken is directed by your healthcare professional. So in this time of COVID, there are new guidelines for doing our appointments. Previously, we've always seen each other in the clinic, but there are newer guidelines where we are actually doing some telephone appointments as well. So when we are communicating with you, either in the clinic or over the phone, we'll tell you how we're going to do all of that. So, you know, that's going to keep you abreast with everything.
Okay, so can I touch and hold my newborn if I had COVID-19?
Absolutely. It is so important to do that. We want you to be connecting with your babe as soon as your babe is born. All of the skin-to-skin things that we talk about in our prenatal classes, when I see you in the clinic and we're talking about things like that, yes, absolutely, you can hold your baby. Following delivery, should a baby still be immediately placed skin to skin and breastfed if the mother is suspected or confirmed to have COVID-19?
Yes, you can do that right away as soon as the baby's born. So you can still do that skin to skin care, or otherwise it's called kangaroo mother care. And so that helps to promote the temperature control of newborns, and it helps with the survival rate of babies. So we want to have that continued connection, which we always try to promote.
So next question, can COVID-19 be passed through breastfeeding?
No. They have been doing some testing and they have found that is not. So it is safe to breastfeed if you have COVID-19, so there's no reason to stop as well.
So sort of the same kind of question, can women with confirmed or suspected COVID breastfeed?
Yes. And so with that, they should take some extra precautions by washing their hands frequently with soap and water, or using an alcohol-based sanitizer. And you could wear a medical mask during with any contact. And if you're needing to sneeze or cough, using a tissue. And of course, throwing that out right away, washing your hands after that. And then you want to clean any surfaces with disinfectant.
So if a mother confirmed or suspected to have COVID doesn't have a mask, can she still breastfeed? Like, is she going to say, oh, I can't do it because I don't have a mask?
No, she can still do that.
Yeah, great. Yeah. So if I had COVID and I'm not feeling very well, or I'm too unwell to breastfeed, what can I do?
Well, if you're too unwell and there's other complications, you should be supported to safely provide your baby with breast milk in a way that's available and acceptable for you.
Great. And we have breast pumps, so that's helpful. And we are able to share them with any community member. Amanda has them ready to go. And she will give you instructions on how to use them. So pumping your breast milk and then storing it so that you have it.
Yeah.
And then you're able to feed your baby the breast milk through a bottle.
Yeah. Nice and safely.
Yes. I have confirmed or suspected COVID, and I didn't breastfeed. I was unable because of the confirmation of the disease. So when can I start breastfeeding again?
Well, as soon as you're able, that you feel well, that you're able to do that. So there's no fixed time. We can't put a time stamp on that. So you got to wait till you're feeling better and that you're able to do so physically.
Yeah. So if I was pumping prior to that, then my breast milk would still be available to me.
Oh, for sure.
Yeah.
Definitely.
Great. Is it, I think from what I understand you telling me then, it's not any safer giving a baby any formula. It's safer actually to breastfeed.
Yes, for sure. We always try to promote breastfeeding. There's no measurement. You can't, so no.
Yeah, but it is a personal choice as well if people want to breastfeed or if they want formula feed. Yeah.
And that's always a choice.
And we support them either way.
Yeah, for sure.
So that's our little kitchen table talk for today. We hope you've enjoyed what we've shared with you. Our office is at 79 Palchase Trail. The telephone number is 705-859-1262. Our office hours are 8 to 4, Monday through Friday. Right now, our office is closed to the public, so our front door is locked. But if you're looking for something from us or need to talk with us or whatever, just give us a call. And then if we're arranging a pickup for something, call us just before you're coming. We will have it ready for you. You knock on the door, you stand back off the porch. We put the item out on the porch for you, and you come up onto the porch and pick it up, and you're good to go. So thanks so much for listening, and we enjoyed sharing. Have a good day.